Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Lantus. Lantus is a type of insulin. It's a long-acting insulin. You only have to give yourself one shot a day, but additionally, you have to give yourself other shots around mealtime because this is just a basal insulin. It doesn't take care of those spikes around the meals. But let's put insulin in perspective. If you have diabetes, chances are after about 10 or 20 years, you're going to need some kind of insulin product. And some people are going to need it within a period of as short as 2 or 3 or 4 months. The goal, if you have diabetes, is to get your sugar back down to normal. That's a glycosylated hemoglobin of less than 7. Unfortunately, a lot of people have their glycosylated hemoglobin over 9, and if it's over 9, chances are you might have some symptoms of thirst or hunger. Maybe you have frequent urination or weight loss. Unfortunately, once your blood sugar, the fasting blood sugar, gets over 250 random, over about 300, and you become symptomatic, it's almost always going to be diet and weight loss. But you're going to need something more quickly, so you might want to opt for a pill or a different kind of anti-insulin medicine, a different kind of a shot. Well, they can be used. You take the pill for a couple months. If it doesn't work, maybe add another kind of a pill, maybe a shot. But ultimately, you're going to end up on insulin. Now, we have different kinds of insulins. They're broken down as far as the onset of action. So we have rapid acting, short acting, we have intermediate acting, long acting, and ultra long acting insulins. So if we're talking about a short acting insulin, you give yourself a shot 10, 20 minutes before you eat. It's only going to last for about 4 hours or so. If we're talking about the short acting, the regular insulins, give yourself a shot maybe 30 to 60 minutes before you eat. It's going to last for maybe 8 hours. We want an intermediate acting insulin to give yourself some insulin throughout the course of the day. You have to give yourself 2 shots. Tend to work after about 1 to 3 hours, last 10, 15 hours, maybe some of them up to 24 hours. Then we have long-acting insulins. Long-acting insulin would be Levemir would be one choice. Lantus is another choice. Lantus is insulin glargine. Insulin glargine, there are several different types of that. There's Lantus, that's the primary example. Toujeo is the new insulin since the patent ran out on Lantus, same company, same medicine exactly, just a little more concentrated, but doesn't have anything to do with the amount that you're going to use. The onset is after 30, 60, 90 minutes. There's no peak. It just is a basal. It's just around-the-clock insulin to make sure that when you're not eating, your sugar doesn't get up too high. Now, to make matters a little more confusing, we have different sources of insulin. So we have animal insulin, the old-fashioned pig or cow insulin. Then we have human insulin, but human insulin isn't really made from humans. What it is made in a laboratory. And then we have the analogs of insulin. These are insulins that are manufactured in the laboratory that are different than the human strain. And they're genetically engineered, so they either last longer or they're shorter acting insulins. Well, if we talk specifically about Lantus, Lantus is insulin glargine. The options for insulin glargine at the present time are either Lantus or just the more concentrated form, Toujeo, or Basaglar, which is a biosimilar equivalent that recently came on the market. The onset, 60 to 90 minutes. There's no peak activity. It lasts for about a day. Covers the basal needs for the entire day, but you have to give yourself some of the short-acting or regular-acting insulin around the time of a meal. Lantus was originally approved by the Food and Drug Administration in the year 2000 to treat type 1 or type 2 adult or pediatric patients with diabetes type 1 or type 2 diabetes in adults. It's not for people who have diabetic ketoacidosis. It's injected underneath the surface of the skin subcutaneously around the same time every day. The dose is variable depending on your metabolic needs. Some people need a little bit, some people need a lot. You don't dilute it with any other kind of insulin. You don't use it intramuscularly, you don't use it intravenously, you don't use it with an insulin pump, and you don't use it if you're hypoglycemic. You want to rotate the sites where you inject it the thigh, the abdomen, or the upper arm. When you change from one form of insulin to another, or you change the dose, you want to monitor yourself very carefully so you know you don't become hypoglycemic. You only want to use the medicine if it's clear and colorless. It comes in two forms, either in a vial or in a preformed pen. Now, if you're going to use a preformed pen, do not share it between individuals, even if you're going to change the needle. That's not appropriate. And you want to check the label whenever you use insulin. You want to check the label, read it, and make sure you're using what you think you're using, because I guarantee you, you're going to make a mistake at some time when you have two different kinds of insulins in the refrigerator or on the counter, and you're going to pick up the wrong one, and that could get you in a lot of trouble. You could get hypoglycemic, and you could have significant problems if you inject the wrong kind of insulin. Now, you can store the medicine in the refrigerator, but you take it out an hour to 2 hours before you use it. Check the pen to make sure it doesn't have any bubbles in it. You can dial anywhere between 1 and 80 units. And after you use the pen, the pre-filled pen, once you inject yourself, you keep the needle in the skin for a count of 10 to make sure all of the insulin gets out of the needle. Remember, it's subcutaneous, but that's dependent on the size of the needle, so you buy the right kind of needles. If you inject it intramuscularly, too many blood vessels, it's going to get absorbed too fast. Your sugar is going to fall. And if you inject it too superficially, well, it's not going to be absorbed very well. Fastest absorption is from the abdomen, intermediate from the arm, and slowest from the buttocks or the thighs where there's more fat. Since the insulin is going to form a precipitate underneath the surface of the skin, anything you do that increases the circulation is going to increase the absorption and maybe push down your sugar even more. So you want to be careful if you're exposed to too much heat, exercise, sauna, even massages. And by the same token, if you slow the blood flow to the skin, you're going to decrease the absorption. So if you smoke a cigarette, that's going to constrict the vessels. If you get very cold, that's going to cause the problem. If there's a decrease in blood supply because of scar tissue, going to have a problem. Now, insulin glargine, or the Lantus that we're talking about, is made in the laboratory from a bacteria. And it's made at an acid pH, so it stings a little bit when you get the shot. But what happens is, once it gets into the body, it's neutralized. And at a neutral pH, at the body's pH, what happens is you get a microprecipitate underneath the surface of the skin. And that's what makes the insulin glargine, or the Lantus, so slowly absorbed, why it lasts throughout the course of a day. Little change in the amino acid structure, but that's okay. And remember, insulin glargine comes as Lantus, 100 units per milliliter, or Toujeo, which is exactly the same thing. It's just 300 units per milliliter. So they make a big choice, or a big stink on the television these days with the advertising that there's you should go and use Toujeo. That's just because the patent ran out. There's too much competition for Lantus. Unfortunately, there's a problem with some counterfeit medicines that are on the market. So if you're getting it through the internet, be extraordinarily careful. Once you get the Lantus, you should store it in the refrigerator. It should be between 36 and 46 degrees till the expiration date. Should not be frozen. If you have the vial, once the vial has been opened, you should keep it at room temperature, or you can put it back in the refrigerator. You can keep it for up to 28 days. The pen, on the other hand, once it's open, you should keep at room temperature. If you're pregnant, typically what's going to happen is in the first trimester, you're going to need less insulin. In the second and third trimester, you're going to use a lot more insulin. And the insulin requirements are going to rapidly plunge after you deliver. Nursing, well, you might need to change the dose a little bit. We know that insulin works by causing an uptake of the sugar into the muscle and into the fat. It stops the liver from manufacturing a lot of sugar. It stops the breakdown of fat and protein. Actually, it manufactures protein. Well, the original studies that were done didn't show that there was all that much difference between the regular kind of insulins and the Lantus. some later studies showed that, oh yeah, hey, we get some significant improvement. We can reduce the glycosylated hemoglobin from, say, about 9% to 8.5% if the goal is a blood sugar of less than 120, and we'll accept only about 5% of the people developing hypoglycemia at night. But if we really want to get good control, Lantus seems to be able to do that, but you need a lot more Lantus. So you're going to have to take a lot more units and have a lot greater risk of hypoglycemia at night. But you can decrease the glycosylated hemoglobin by about 1.5%, and that's pretty good. But if you look at the average population out there, the people who have diabetes, what's going to happen is you look at a person who's maybe 55, 60 years old with diabetes for about 10 years. They tend to be quite overweight or even obese. Well, if they haven't been controlled with regular medicines, and they start off with a glycosylated hemoglobin of about 8.5 to 9, what's going to happen is they're going to reduce the glycosylated hemoglobin by about 0.5%, and the sugar is going to decrease by maybe about 25 to up to 50 milligrams. And that might not be enough. That's why you need extra kind of medicine. And one of the problems with any insulin preparation, Lantus included, is it's going to cause you to gain weight. Now, when the medicines are approved by the Food and Drug Administration, they're approved on the basis that they cause a reduction in the sugar. They are not approved specifically because they're good for other things. They're good for making you live longer. We know that diabetics have a very high incidence of heart disease. What does Lantus do for heart disease? Doesn't change it. Doesn't make it better. Doesn't make it worse. Doesn't seem to increase your risk of cardiovascular disease-related deaths or heart attack or stroke. Doesn't increase or decrease your risk for revascularization. Doesn't increase, decrease your risk for cancer. But if you take insulin, one of the major risks you're going to have is you're going to be potentially at risk for hypoglycemia. And unfortunately, the longer you have the diabetes, the fewer the symptoms you're going to have, so you can have hypoglycemia and not even know it. Well, if we look at people who have hypoglycemia, there's going to be an increased incidence when you change the dose, or if you change the kind of meals you're eating, or change the constituents of the food you're eating. You cut way back on the carbohydrates, or you're taking other kind of insulin-reducing medicines, or you have liver disease or kidney disease, or you have an impairment in your ability to recognize the symptoms of hypoglycemia because you're taking a beta blocker, or maybe you're taking clonidine, or maybe you've just mixed up the insulins and you're taking the wrong shot. If you have a mild case of hypoglycemia, well, you just take some carbohydrates and change your dose, lower your dose. On the other hand, if you have severe hypoglycemia and you need somebody else to help you, you have some neurologic impairment, increase your risk of driving, of course, you develop coma or seizures, then you need somebody else to give you sugar, probably an injection of sugar, or maybe some glucagon. Now, there are some drugs that can increase your risk of developing hypoglycemia, and they would include some of the popular blood pressure lowering medicines in the family of the ACE inhibitors, or the angiotensin receptor blocking drugs. Those would be examples, valsartan or lisinopril. The fibrates used to keep your triglycerides under control. Even aspirin and sulfa drugs that you might take as an antibiotic can cause problems. So too, obviously, when you compound it with other anti-diabetic medicines, or if you're taking an MAO inhibitor. And some drugs can block the symptoms, so you can develop hypoglycemia and not even be aware of it if you're taking a beta blocker, if you're taking clonidine, or one of the older medicines that we use called reserpine. And there's some medicines that seem to prevent the insulin, prevent the Lantus, from lowering your sugar as much as it ordinarily would. Those would be drugs like thyroid pills, or progesterone, birth control pill, estrogen. Maybe you use some albuterol for asthma, or you're taking an antipsychotic drug like Abilify that's used for depression and for schizophrenia and a variety of other problems these days. Or maybe you're taking some niacin because you think it's helpful for you. Maybe you're taking some epinephrine, or maybe you're taking some Sudafed. Variable effects if you're taking alcohol. Now, are there side effects of the insulin other than hypoglycemia? Sure. Every time you take a medicine, you could have a side effect. The side effect, well, when you give yourself a shot, you could get some redness, swelling, irritation, or inflammation at the site. The likelihood of an allergic reaction to insulin, very low, but because it's an anabolic product, it's going to increase your body weight. You'll gain anywhere between 1 and 6 pounds on average. Sometimes it makes you retain sodium. When you retain sodium, you might get some leg swelling, might have worsening of congestive heart failure, and certainly that's compounded if you're taking it with another anti-diabetic drug known as Actos. It seems that the potassium moves into the cell from the bloodstream when you're taking insulin. That can lower your body's potassium, and if that happens, then that could cause some heartbeat irregularities, so you need to monitor that. Well, the patent for Lantus ran out in 2015, so Santa Fe Aventis, that's the company that makes the Lantus, they came out with another insulin glargine, as I mentioned, Toujeo, in 2015. That's around the same time when Lilly, a competitor, came out with the Basaglar. That's another insulin glargine. And Novo Nordisk came out with its product known as Tresiba. How much does it cost? Costs too doggone much is the answer to that. 1 10 milliliter vial of 100 units per milliliter. One vial of that, cash price $275, but on GoodRx you can get it with a coupon for $179, except if you go to Kmart it's going to be more expensive. You could go to Canada where the price in Vancouver is $115. Now you have to buy the needles and syringes, and you have to buy a container for the used needles and syringes in addition. On the other hand, if you want the pre-filled pen, you could get 5 pens at 3 milliliters. On GoodRx, the price at the beginning of May 2017 was $380, but because of the competition, because of a variety of other factors, it fell. By the end of May, it was only about $266. Bernie Sanders, he got into the whole situation once upon a time when he tweeted that it makes no sense, and I quote, that the same medicine that you can buy in France for $70 a vial costs about $450 in the United States. He said we ought to be able to import medicines from out of the country. That might make a lot of sense, actually. So long-acting insulins, do they make sense? Yeah, they make sense, but they might not be as cost-effective as maybe some of the intermediate-acting insulins that might cost less, maybe like the NPH insulin. NPH insulin only going to last about half a day, 14, 16, 18 hours, versus the Lantus that lasts up to around 24 hours. You give yourself the injection in the same spot. Then we have the Basaglar. Basaglar is the new Eli Lilly product. It had tentative approval for marketing in August of 2014, but Santa Fe, the manufacturers of Lantus, filed a suit under the Warren-Hatch Act, so they got a delay. So the product, the competition, didn't really get approved for actual use in the United States. It was launched in December of 2016. Why is it so important for Santa Fe to keep tabs on this drug? Well, because it causes 1/3 of the operating profit of the company. Lantus had sales of about $8 billion worldwide. Then with the competition, it plummeted by about 30%. The insulin market is slowing down because there's so many competitors, and some of the pharmacy benefit managers are wising up, and they're striking deals for at least those people who have insurance. The sales had been going up at about 20% a year for Lantus, but now they're going the opposite direction. They increased the price. They actually doubled the price over a period of about 5 years, but they complain that their profits actually were down 17% in 2015, down another 10% in 2016. That's because all the discounting that's going on. So what's the bottom line on Lantus? Well, if you're type 1 diabetic, you need to take insulin. Unfortunately, at the present time, there's no getting around it. We have some options that might be available in the near future, but that's right now, type 1 diabetic, you need insulin. On the other hand, if you have type 2 diabetes, chances are you're either overweight or obese. In other words, you're too fat. And you're going to pay a gigantic premium for those cookies and candy bars, the pizzas and the fried chicken. And unfortunately, it's going to be not only a health premium, but it's going to be a financial premium. So the first treatment for diabetes, for treatment and for prevention, is an appropriate diet. And most people are not on an appropriate diet, even people who are following the American Diabetes Association diet. You're not on an appropriate diet to treat the condition. So once you get on an appropriate diet, you might not even need any insulin. But if you need insulin, Lantus is okay. But there are other choices, probably better choices, that can reduce the likelihood of your having a heart attack or a stroke. So which ones are they? Keep watching our shows and you'll find out. Thanks for watching. I'm Dr. Ken Landau.